So I was going to start things off. I can let you drive a little bit if you want. I cannot believe, but I guess I can believe, right? COVID derangement syndrome is what I'm going to call it now. I think we've officially just like we've jumped a shark. We're going to be in a new place where things are just statistically, we kind of understand where we are. We talked about the South Africa discovery of Omicron. We talked about it being so much more contagious and less virulent. All of that is checked out. All of that appears to be the case. The world is still in hysterics as though none of that is true. And I posted a headline on our tampadispatch.com. You can go over there, folks. It's a world news story, but it was still couldn't ignore that the Chinese locked down yet another town, another city, a province, call it what you will. 1.1 million people. That's in addition to the 13 million that have already been locked down in their homes since before Christmas. December 23rd is when that took into place, to the point where we have reports and videos on Twitter leaking out through different sources on social media now, where folks are not even able to get medical attention, like actual hospital care. One lady was pregnant, rushed to the hospital. She was bleeding, ended up losing her baby. I mean, Bob, we are 2 years. I mean, well, you and I have been talking about this. It was actually in the fall right before 2020. So, we really are 2 years for us, because we were talking about this starting in Asia and that kind of thing. But for you, I mean, where are you at on this? Are you still shocked and surprised by this level of hysterics over something that has proven to really not be as dangerous as it was, let's say, 18 months ago, 12 months ago?
No, I think it's pretty much where I figured it would be. The media is going to continue. The politicians were going to continue. The public health officials that are on TV all the time will continue. But I think outside of that, people are catching on, and they're just not. They know enough now that they're starting to recognize that what's going on. And yes, if you are sick, stay home, don't go to work, treat it just like any other respiratory virus. And there's no need to shut things down. There's no need for it. Protect those that are elderly and protect those that are infirmed. But everybody else should just go on with their life as if it's flu season. Omicron is definitely way more transmissible. As a matter of fact, we had 1 million cases yesterday, I think it was. I mean, that's astronomical in the United States. That's beats all records by hundreds and hundreds of thousands. But it is. It's close. It's very close to measles as far as transmissibility, which is the most transmissible virus that we know about. However, viruses want to survive, and as they mutate, they typically do become less pathogenic, less virulent. And I think that's what we're seeing. And South Africa is definitely showing that in the charts. They saw their peak November into December, and now it's the decline is very sharp. It's gonna hit everybody. Nobody's gonna hide from this. You may not know that you're infected, but nobody's gonna hide from it. And I think we're gonna go through something very similar the way South Africa did. But there's no hiding from it. There's no hiding from it.
This is possibly the craziest thing I've seen so far. I don't know if you've seen this. This was actually tweeted out. Adam Carolla retweeted this. This is they kind of like hit a little bit about where it's going, but a person leaked this out about the Zoom meeting protocol in their company. Quote, team, I am writing you all today to inform you of a new protocol for our staff Zoom meetings. Moving forward, everyone will be required to wear a mask during our meetings. One of our team members has a fear of unmasked people, and I want to make sure everyone feels safe and comfortable. This requirement is effective immediately.
Yeah.
Bob, I mean, what on earth? How do we hold society together? We have someone that is so afraid of all of this that they are asking their companies to have everyone wear a mask on a Zoom call, and the company not only complies, they're basically making their staff do it.
Yeah, I mean, the insanity has set in, and there's going to be that portion of society that's going to continue on like this. There's going to be people that are never going to take their mask off. They're just never going to. When flu season comes around, when the next variant comes around, coronavirus is going to be an endemic probably, and they're just never going to take their mask off. But the bulk of the people are going to move on. Even Ocasio-Cortez knows. She was down here maskless doing her thing in Florida, getting away from all the burdens of New York. And she knows, even though she's for all these regulations, people know. People are catching on very quickly. Fauci's starting to have to admit stuff, right? He's starting to admit, that it is probably less pathogenic. He is admitting that, yes, children need to be in school. I mean, it only took them 2 years, but the cable news stations, that they're all starting to get on board to different degrees because they know. Yeah, and I think a lot of it is political too. They see that, they're running out of their rope, and they're going to take whatever left they can get, but they know it's almost over. And if they continue with these shenanigans, the elections are going to be brutal. I mean, they already are, but this is not going to help matters at all. Just my opinion.
Yeah, this is the picture. The New York representative in Florida. This is a event or something like that. Here she is, AOC, center stage. This person has a mask on, but it's down near their chin. No mask anywhere else in the photo. Yeah. We generally see that this pattern is not new. Segment on people in California, New York, all these different politicians, officials traveling. DeSantis made jokes about, I wish he had a nickel for all the time these people came to Florida, escaping their lockdown states and that kind of thing. So all of this is pretty commonplace. But the hypocrisy levels, especially during the holidays, we have people calling for us to cancel Christmas, and these photos leak of the shenanigans. I'm actually shocked there's only like the one person that was kind of brought out. I figured there'd probably be more than that. So,
yeah,
Bob, is the craziest thing that you have seen in the last couple of weeks?
The craziest thing? I'm sorry, bro, you broke up a little bit.
I was just asking, what is the craziest thing that you have seen in the last couple of weeks?
Following the people on Twitter, there's certain people that just continue the real fear mongering. There's a guy on Twitter. He's actually a PhD nutritionist and an epidemiologist, but he's gaining his fame on Twitter by putting these long strings of things together. His name is Eric Ding, Dr. Ding, and he'll put out a tweet about, show some kind of a chart from New York City, how high it's going, or Florida, which of course they are going on. And he'll always start out his tweet in all caps and lots of emojis. And then there'll be like 15 tweets following that. He is, I don't know how he finds the time to do these long tweets, but his whole motive, he'll never talk about things that are positive coming out of this. He'll never say that, yeah, South Africa is getting in better shape. He'll never say that, yeah, the death toll due to this newest variant is exceedingly low. He'll mock people for saying it's less pathogenic. And so I think there's this little group of Twitter people, and MDs and PhDs mostly too, and they're just so caught up in this. And then they have their people that follow them, and they're avatars are a lot of them are pictures of them wearing masks and stuff like that. It's just, there's going to be a group that's not going to stop. There he is.
Yeah, there's Eric Ding. New York Times here in the background. You see all that.
So that's if you go up to his pinned tweet, bro, that's the one where he got famous. Holy Mother of God.
The tweet was exactly 1 year ago today. For those of you who've been with me this past year, I hope you pray for your families. You're safe. Let's work together the pandemic. Yeah.
So that was a long time ago, but
that was January 24th, 2021. So it's almost exactly a year ago, just 3 weeks shy.
Yeah. So he's just, he's horrible. He has a thing out for DeSantis. Apparently he once ran as a Democrat in Pennsylvania. He's not an infectious disease specialist. That seems to be the criteria for anybody saying, they'll say that the Florida Surgeon General is not an infectious disease specialist. Well, neither is this guy. He's a nutritionist. And he's been called out quite a bit. He's kind of buffoonish in a way. He'll just do really stupid things. Like, I don't know, probably about a year ago, he did a tweet about the country of Wales, Wales, and he put a emoji of a whale on it, and all these people started calling him out, saying, "Dude, it's not WHALES." So he's just foolish in that way, but he's just a superior fearmonger, and that's, you're never going to see anything positive out of his tweets.
What's the craziest thing you've seen in person? Have you seen anything really in person in the last month or so where you're like, man, it's a little... So I've seen the double mask still, which I thought we've kind of skipped that. We've got past the double masking stuff. I still see people who are really fearful. They're probably high risk, meaning that they're, let's say, morbidly obese. So maybe rightfully so, they should be concerned, but they'll wear like the gator cloth or surgical mask, which is basically completely useless in the grand scheme of all of this. Mm-hmm. Those are kind of like the things I kind of shake my head, or I kind of, under my breath. I don't obviously say anything to anybody, but those are kind of the weirdest and craziest things that I've seen.
No, I mean, when I go to certain places, some places are starting to encourage mask again, and I'll throw one on just to be hospitable to the company. But I have seen a lady chastise somebody for not wearing a mask, so that's still going on to low degree. But I'm kind of waiting for the time when somebody does that to me, because I think I'm going to take a different instead of arguing with them, I'm going to just start laying out facts, start listening to all these studies and stuff like that, and see what they say. And at that point, they're just either going to shut up or they're going to cuss me out and walk away. But
I want to make sure we film that. That's all I want to say.
Yeah.
Make sure we have someone there to film that.
And I get it. I mean, it is transmissible. It's very transmissible, and people are trying to protect themselves. I don't know how much use the mask is going to be unless it's fit tested N95. If it's just a surgical mask,
but I've heard that even with the N95s, there's been some reports where some of those, and again, you don't know, right? So you don't know if they were not wearing it properly. You don't know if it happened to be when they took it off. You don't know anything. But some of those have been, like, there's reports of them not being quite as effective.
That's the thing about it. I think a lot of people don't understand. I mean, when you wear an N95 in a hospital or in a lab or something, they are fit tested.
Yeah.
Right. They get put on. You get like a plastic bubble put over your head. They blow flavored smoke in there, and you shouldn't be able to smell it.
Hey, we're News Talk with Brandon and Bob. We're here to tell you about some of the facts so you don't have to waste your time watching CNN.
We don't want you wasting any time with CNN.
Or Fox or MSNBC or some of these other guys that are making a whole lot of money.
Et cetera, et cetera.
It's not paying.